episode of Banner Health's Making the Round podcast, we'll be discussing shoulder and elbow surgical innovations, from joint sparing techniques to the latest in recovery and treatment strategies. We'll cover both open and arthroscopic surgery, why surgery might not always be the right approach, and the critical relationship between the referring physician and the surgeon in positive patient outcomes. To learn more about these topics and other orthopedic-related offerings at Banner Health, please visit bannerhealth.com/orthopedics. Making the Rounds dives into medical topics with those who know them best, healthcare providers. My name is Bridget, and I'll be your host for today's episode. If you're new to our podcast, thank you for tuning in. And if you're a regular listener, welcome back. With me today is Dr. Midhat Patel, a shoulder and elbow orthopedic surgeon at Banner University Orthopedic and Sports Medicine Institute in Phoenix and Banner Sports Medicine Scottsdale. He's also a clinical assistant professor at the University of Arizona College of Medicine, Phoenix, Department of Orthopedics. Thank you for joining me today, Dr. Patel, and welcome to Making the Rounds.
Thank you guys for having me. I really appreciate it.
Well, we're excited to have you. Dr. Patel, tell us a little bit about yourself and how you got into orthopedics.
I grew up in a small town in North Texas. My parents made sure that I was doing all of the possible activities I could, so I played a bunch of different sports, which means I wasn't really that good at any of them, but I got exposed to a lot of different things. And as I got into college and then into medical school, I realized that what I wanted to do was to do a field in medicine where I'd really be able to help have a positive impact on people's lives and have them be able to go back to the activities that they want to do. And I noted when I was a first year medical student, I did an elective in orthopedics, and there was a patient who walked into our clinic, and the attending turns to me and goes, "That's really cool. This lady came in a wheelchair 6 weeks ago." And so I kind of had an early imprint of how in orthopedics you can have a very positive, tangible impact on people that are active and want to go back to doing the things they want to do in their life. And I was fortunate to be able to do that.
Oh, that's wonderful. Tell us a little bit about why you chose shoulder and elbow orthopedics.
Sometimes things can get a little bit repetitive and you want new challenges or areas where technology is really involved in the process. And those are the things that I enjoy. And shoulder and elbow in particular is a little bit of a younger field in orthopedics, and one in which there's a lot of room for innovation and sort of answering questions that don't have very good or clear answers yet. And that's where academic medicine comes into play as well, where you're able to participate on the research side and answering some of those questions. And more than that, also, shoulder and elbow surgery allows you to take care of a spectrum of patients, from the young athlete who dislocates their shoulder playing high school football all the way up to somebody who's got degenerative changes or arthritis or a shoulder replacement that needs to be fixed even. And so I really enjoy sort of that breadth of pathology that you can take care of.
You mentioned arthroscopic surgery and the importance of being skilled in both open and arthroscopic surgery. Can you share with us how these techniques complement each other in your practice?
Yeah, actually one of my non-operative partners and I were just chatting about this earlier today when we were talking about medical imaging, in the sense that if you don't get to see all the parts of what you're doing, it's hard to really put it into context. And so what we meant by that was, if you look at an MRI, but you've never seen the inside of a shoulder, or you've never correlated your MRI image to a shoulder, it's hard for you to really understand how that translates. And so with arthroscopic surgery, if you never really do open shoulder surgery, it's hard to get a sense of what it is that you're doing when you're looking at things from a camera and a magnifying glass at an angle, using tools at a distance on a screen, so to speak. Versus with open shoulder surgery, if you only ever do open shoulder surgery, you don't really get an appreciation for how much you can do with small incisions and tools at a distance on a screen. And so I think being able to do both and being skilled in both is important, because it gives you a better idea of how you can best treat things and what really needs a more open or quote unquote invasive approach versus what can benefit from a more minimally invasive approach like arthroscopy. Although I would argue that some people think arthroscopy always means less invasive, and I don't think that's necessarily true, but that's something to talk about with a surgeon or your doctor.
Can you share with our listeners what really sets you apart from the other surgeons who are performing the same surgery?
Yeah, so I didn't mention this earlier as part of why I chose shoulder, but I was lucky to do my training and my residency here at Banner University, and a couple of the folks that are here are very involved in research and academics and even implant design for the modern reverse shoulder arthroplasty and some of the technologies that are available. And then I was lucky enough to go do my fellowship at the Cleveland Clinic, where they actually were instrumental in demonstrating and understanding why CT scans are important and helpful in shoulder replacement surgery, and then developing tools like preoperative planning software and patient-specific implants, and continue to evolve in things like virtual mixed reality and robotics. And so one of the things that I really enjoy and have been exposed to frequently is using some of those technologies. An example of that is preoperative planning software, which is something that I do for every case. So my patients get a CT scan ahead of time. That CT scan gets uploaded into a software, and I'm able to essentially digitally perform a surgery ahead of time and have a plan. And then when we get to the operating room, our goal is to execute our plan with as much information as we could possibly have ahead of time. Here, this video is an example of a case that I planned on the planning software that I utilize. And I'm going to go ahead and play this and talk over it just a little bit. And this is a patient who was presented to me with a complex problem where she had a fractured glenoid. And the way to treat this, along with her acute rotator cuff tear, was with a reverse shoulder replacement. And as you can see, the software, both in 3D and 2D, lets me put my implant in virtually and kind of make sure that I'm able to get the screw purchase and have the real estate that I need to put my implants in. And then this plan is exactly what I look at in the operating room. So somebody in the operating room has a tablet or a laptop where they pull this plan up and let me look at it ahead of time. And then I'm able to execute that in the situation that I'm then facing in the operating room. And I find it very, very helpful and almost absolutely necessary at this point, because I think it's a very useful tool that you're able to utilize if at all possible.
And we've heard this in a couple of our podcasts with some of our other surgeons in orthopedic and neurology, is when you get in your car and you get ready to go somewhere, you're always planning where you're going. You put in your directions in the map. You're routing everything that you're doing. And that is the layman's way of looking at, all of the intricacies that you're doing in that surgical suite.
Yeah, no, I totally agree. I mean, I would argue, and this is a tiny bit controversial, but it's almost becoming standard of care if you're going to have a shoulder replacement, to have a CT scan ahead of time to really evaluate the bony anatomy of your shoulder, and then to have the software utilized to plan your surgery. And now sort of the next frontier of the technology is, how do we take this plan that we've put into our computer and really execute it in reality? And so one of the things I was able to do in training is to utilize what we call mixed reality goggles, where I put on a set of Microsoft HoloLens goggles, and rather than someone holding the plan up in front of me on an iPad or a laptop, I actually pull a 3D version of my plan out and put it virtually on my patient in front of me on the drapes next to the surgical field, and look at my plan and look at the patient's scapula and where I want that implant to go, while I'm looking at the patient's actual scapula live in front of me through the glasses. And it's a very, very helpful and useful tool. And at Banner, we're fortunate to be sort of at the forefront of being able to use new tools as they come out. And so kind of the next iteration of that technology is to have guidance, where we have specialized tools that actually make sure that we can only put our implant in exactly where we planned it with that mixed reality. And then the next version of that for shoulders will be with robotic technology, which is already commercially available for knees and hips, but it's coming in the near future for shoulders. And then we'll be able to use a robotic arm to essentially make sure that the implant can only go exactly where we want it to go. And recent data has shown that that gets you within about 0.01 millimeters and 1 degree of where you want to put your implants. And so I find that when you've got these tools available, they're fantastic to be able to use, and I'm fortunate that we're able to use them.
When we're looking at time in the OR, blood loss, all of the wear and tear on your body, translate that to us in regards to the outcomes and recovery.
The more that you're able to plan ahead of time, the less futzing around, for lack of a better term, you have to do in the operating room. I mean, you don't have to eyeball it or see if things look just right or a certain way. And so while some surgeons actually argue that the technologies add time, and undoubtedly do in the beginning when you're adopting any new technology, once you become facile with it, they really speed you up, because there is no more eyeballing things or checking things or double checking. The robot or the mixed reality navigation is only going to let you put it in one place. So you put it in that place and you move on. So it actually decreases operative time in the long run, decreases blood loss theoretically, because you have decreased operative time, or at the very least is time neutral and blood loss neutral, and certainly doesn't add time.
So for patients who experience shoulder dislocations or other injuries early on, what are some of the long-term effects that they should be aware of and that their primary care should even watch for?
The reality is once you have an injury or a soft tissue injury, especially something like a dislocation that's significant, things never necessarily 100% go back to normal. And also you are at an accelerated rate of degeneration in terms of developing degenerative conditions because of your acute injury that you may have had at a previous time point. So what that really means is if you have a history of dislocations and your shoulder starts bothering you and you try to ignore it or you think it's going to go away or things will be fine, that might be true, but I wouldn't ignore it necessarily, and I would at least get evaluated for it and have a higher or lower threshold, I should say, for getting an x-ray or getting a workup just to make sure that it's not something scary or frightening or something that could be easily treated and you're just suffering without necessarily having to.
So when we were preparing for our interview, Dr. Patel, you had brought up a great analogy about degenerative conditions being like skin wrinkles, and we loved this. Can you elaborate on why it's important for patients and referring providers to really understand that MRI findings don't always equal a problem?
Yeah, this is one of the things I'm a little bit passionate about, and I use this analogy too many times every day. But the reality is just like things change on the outside of your body, like your skin wrinkling or your hair turning gray, things change on the inside of your body too. You wouldn't call someone with skin wrinkles pathological or have a problem that you need to fix necessarily. And similarly, I wouldn't call someone with a degenerative problem in their rotator cuff pathological. Now, symptoms are a different issue and we need to treat patient symptoms. And sometimes, and what our job is to do is to correlate imaging findings to the patient's symptoms. But a lot of times there are a lot of things that show up on an MRI and they're read as abnormal or atypical. And that's true. They might be abnormal or atypical compared to what it looked like 30 or 40 years ago. But again, by the same token, your skin looks different than it did 30 years ago too. So I think that it's really important to let your surgeon or whoever is dictating your treatment help you understand that the findings themselves are not necessarily things that need to be changed or fixed, but it's managing your symptoms and correlating that with findings that's more important.
So as we do Botox for our face and our skin wrinkles, and we do rejuvenation, what can we do for our joints? What can we do for the inside?
Exercise, while it seems counterintuitive and might actually be painful, leads to having a healthier environment inside of your joints in terms of the biology of your joint itself. And I don't think anyone would ever argue that having better range of motion and more well-balanced strength, and I want to emphasize well-balanced strength around your joints, is helpful for joint longevity. A very simple thing that we never think about, but I started encountering a lot as I became a shoulder surgeon, is that your entire knowledge base of what you should do in the gym begins in middle school and high school when you have a gym coach having you do 3 or 4 exercises and you start to think that those are the most important exercises. And for most of us, that's, at least for male patients, it's, push-ups, pull-ups, bench press. And that actually leads a lot of us to be very imbalanced in a lot of ways. And so I think that one of the most important things that I try to have patients do, especially younger patients, is to go and see a physical therapist or a trainer who can address where you're imbalanced, meaning your internal rotation is way better than your external rotation, or your ability to push things is way better than your ability to pull things, and help you work on those things to help preserve joint longevity.
I want to shift gears a little bit. I want to discuss the multidisciplinary care that we have here at Banner. You've mentioned in our conversation so far, physical therapy, athletic trainers, medical imaging. Here at Banner Health, we offer both surgical and non-operative care, physical therapy, injections, and more. What role do these treatments play particularly in managing shoulder and elbow conditions?
I've had a bit of a unique perspective in our group because I did my residency here. So I've been here since 2018. And honestly, in 2018, we didn't have this. There was no Banner imaging in 2018. The Banner PT clinics were not nearly as well organized or as well spread out as they are now. The non-operative sports medicine group was probably just a couple of docs at that point. The orthopedic group didn't even exist at that point. And so I've seen over the past 6-7 years now, how Banner's built out this multidisciplinary orthopedics and sports medicine practice. And I think it's invaluable to have people that you can meet and have relationships with and know and trust and lean on, and also recommend to your patients because you know and trust and can lean on those people and those treatments to be able to take care of them. Just having these relationships to make sure we don't get the wrong imaging studies or mistakes aren't made, and being able to do it in a friendly and collegial way where nobody is upset or bothered by it, but in fact really benefits from it, I think is quite helpful.
So as you're talking about having partners, having that care team, tell us a little bit about your collaboration and partnership with a primary care physician.
The primary care physicians obviously are essential because they take care of the patients and they recommend them to you. I've been relatively new in practice, and I've been surprised pleasantly by how much it matters to patients, whether their primary care physician recommends someone to you, and how much the primary care physicians care that you are taking care of their patients and that you communicate with them back and forth. And so developing that relationship has been very helpful in terms of just communicating. And that is invaluable because it makes sure that miscommunication doesn't happen, which miscommunication is well known to be the number one cause of medical errors and issues. And unfortunately, we have a healthcare system with a bunch of parts that don't really talk to each other all that well in the software space. And so having the ability to just know the people that you're working with and talk to them directly is very helpful to avoid that problem.
Dr. Patel, I can't thank you enough today for sharing your expertise and insights with us today on orthopedic surgery. This has been an amazing conversation, and we are so lucky to have you here at Banner Health.
I don't know about that, but I appreciate you guys having me, and I appreciate you taking the time to hear me talk about the things that I'm passionate about.
Well, thank you. Thank you for joining us in this conversation about shoulder and elbow treatment. If you found this conversation as informative as we did, please subscribe to our podcast for more discussions on important medical topics. To learn more about Dr. Patel and the orthopedic specialty services available at Banner Health, please visit bannerhealth.com/orthopedics. Thank you for listening, and we'll see you next time on Making the Rounds.